Good morning, everyone, and welcome to this webinar hosted by the Royal College of Nursing and Sharpsmart Limited. Today, we're joined by Kim Sunley and Rose Gallagher from the RCN and Will Chappell from Sharpsmart. So the team will be taking you through some of the key results from the latest Sharps injury survey and running through the Sharps guidance on the prevention and management of Sharps injuries, all with an aim to empower you and provide you with the resources to drive change within your healthcare facility. Just a heads up, we do have a short video in the webinar, which has been slightly temperamental this morning. So if it doesn't work, we'll pop the link in the chat. And finally, we'll be running a short Q&A at the end of the webinar. So please post any questions in the chat and we'll try to run through as many as we can. So now, without further ado, I'm pleased to hand you over to Kim to kickstart the webinar.
Thank you, Gemma, and good morning, everybody. My name is Kim Sunley. I'm National Officer for Health and Safety at the Royal College of Nursing and have been campaigning around Sharps injuries for a number of years. So I'm just going to start the webinar with a few with sort of background, so we've got a shared understanding of what we mean by Sharps injuries, talk a little bit about the activity that the RCN has been up to, and that will lead on to some of the highlights from our 2020 Sharps survey. And then we're going to start looking at the impact of Sharps injuries on individuals and organisations before I hand over to my colleagues. So the background really, Sharps injuries are where the skin has been broken by a needle or other sharp object. We often sometimes refer to them as needle stick injuries, but I think it's important to point out that other sharp objects such as blades can cause Sharps injuries. They occur when blood and body fluid exposures occur. So if a used needle has been needle's been used on a patient, that can lead to a blood and body fluid exposure, which can then lead to the risk of transmission of diseases. I think it's also important to mention mucocutaneous exposures. So when blood and body fluids come in contact with the eyes, the mouth, or visibly damaged skin through a splash. So that also can present a risk of transmission. We're focusing today very much on Sharps, but I think it's important to acknowledge that mucocutaneous exposures are also a risk. And as I say, they do pose a risk of transmission of disease. Some reports estimate there are about 60 pathogens that can be transmitted through a Sharps injury. We know about hepatitis B, hepatitis C, and HIV, but there's also been recent case reports of Mpox, formerly known as monkeypox, being transmitted through a Sharps injury. And obviously, when you're looking at bloodborne viruses, there are lots of things to consider about the risk of transmission. So the type of sharp used, the depth of the injury, whether the needle was previously used on an artery or a vein, or whether it was subcutaneous, and what the infectivity of the patient where the sharp was used on. So lots of factors to consider. But if we look at the Eye of the Needle report, which was produced by the Health Protection Agency, who are now encompassed within the UK Health Security Agency, they estimated that the risk of hepatitis B from a Sharps injury was about 1 in 3, hepatitis C 1 in 30, and HIV 1 in 300. And obviously we have vaccination for hepatitis B. There are interventions that we can take for hepatitis C and HIV exposures, so to reduce the risk of actually contracting the occupational disease. But I think it's really important to remember the psychological impact that can have on the healthcare workers, as well as the potential risk of occupational disease. And I'll explore some of that as we move along. So obviously, as primary users of sharp instruments, Sharps injuries are a real and present occupational hazard, occupational risk to nursing staff, and it's been a key campaign area for the Royal College of Nursing for the past few decades. So one of the key turning points for us was back in the early 2000s, when an American nurse came to speak to RCN Congress, and this nurse had developed both hepatitis C and HIV from a single needle stick injury. and our members heard about the trauma and the long-term impact that it had on her health and well-being. And she also talked about the campaign in US and US states to get regulations to improve protection of nursing staff, including the introduction of safety engineered needle devices or safety devices. So we carried out our own survey back in 2008, which I'll touch on in the next slide. And that led to our campaign, which took us to Europe, where we met with other European trade unions within the healthcare sector, and also European employers, hospital employers across Europe, where we met and we came to an agreement that more needed to be done to prevent sharps injuries for European healthcare workers. And we had some technical seminars, and we came up with drafting a framework agreement, which then led to the EU directive on sharps instruments. So the EU directive, which became our sharps injuries regulations, introduced that hierarchy of controls. So actually, where do we have to use needles in the first instance? Do we have to use sharps in the first instance? And yes, we usually do in healthcare. We can't eliminate them from every scenario. But where we do have to use them, are there safer alternatives? And then looking at things like training, the environment that the procedures being delivered in, looking at reporting and also follow-up. So those were the principles within the directive. So we developed our first sharp safety guidance in 2012 in response to the directive to help organisations prepare. And then when the regulations came in, we updated that our guidance. And then we just recently, at the end of last year, beginning of this year, we did a further update following the results of our sharps injury survey. So I'm just going to go on and just talk about a few highlights from our survey. So we commissioned this in 2012 by Terry Grimmond and Associates actually worked with us to develop the survey where we wanted to ascertain members' exposures to blood and body fluids. We also talked about the perception of risk, whether they reported incidents and what sort of follow-up and support they had following an incident. So just some highlights. Well, but first of all, say put a bit of context behind this. So this was carried out towards the end of 2020, and you probably don't need any reminding that that was really, we were really in the peak of the pandemic then. So the autumn winter of 2020, people working intensively, nursing staff, healthcare staff working intensively in full PPE, in extremely challenging situations. And also, we also having a big push with flu vaccinations and the start of preparing for the COVID vaccinations. So lots of sharp instruments being used, lots of procedures that could risk exposure to mucocutaneous exposures, and also staff wearing full PPE as well. I mean, surprisingly, we had a good response rate. Over 7,500 members responded to that. So again, given the context, it's quite a good sample. So just to highlight, 63% had had a sharps injury in their career. That's slightly up on the 2008 survey where 48% said they had. 15% had a sharps injury within the last year, and 3% had sustained more than one injury. So that 15% is up on 10% back in 2008. So there's a rise in injuries there. 20% had had a mucocutaneous exposure in the last year. And then these two really stand out for us. I think 17% did not formally report their sharp incident, and 40% had not received any follow-up disease risk advice. And that was markedly up from 2018, where it was 28%. So again, I think those figures need some unpacking and some further follow-up. So those are the highlights from our survey. So I next want to move on to look at the impact of a sharps injury on the individual and look at the impact on an organisation. So Hopefully with the IT gods are with us, we should be able to play this short video. So the video is from a senior staff nurse at St George's Hospital who talks about her experiences following a Sharps injury, and just to credit St George's Hospital for making this video for us. Making this video, which is freely available on YouTube.
The possibility of having that. So they gave me my first PEP that afternoon. And I also think that there's a very tight window, so you have to take it within 1 hour of when you get the needle stick. I think one of the hardest things was the difficulty speaking to people, because a lot of people reacted differently from me, and so I found people being negative about it really hard to cope with. So when they told me that they couldn't gain consent from the patient, I thought, fair enough. If you're telling me that, then I believe you. That's the type of person I am. Whereas other friends, including my husband, were incredibly angry. And I just found anger, other people's anger, adding to all the emotions I was feeling, really hard to deal with.
I think it's a very powerful reminder of the impact, the psychological impact that Sharp's injuries can have on an individual, and the stigma still attached to it. And also, yeah, from talking to nursing staff who've had needle stick injuries, they say that, you know, occupational health can say to me that the risk is very low. The risk is 1 in 1,000, 1 in 5,000. But to me, that risk is just 100% at that time of having that injury. So I think that shows the importance of good psychological support. Well, the importance of prevention, but also the importance of good psychological support if an incident happens. So here we've got a report of this is taken from a report done by the Health and Safety Executive, and it looked at the psychological and social impacts of workplace injuries. Looked at lots of injuries from being crushed by machinery, you know, having limbs crushed by machinery, but also it had a case study of a doctor who suffered a needle stick injury during work as a surgeon and needed to potential risk of hepatitis C, went on interferon and other antiviral agents for 6 months. And it talks about, the case study talks about the impact the treatment had on her physical health, constant monitoring for white cells, and also just impact nausea, anemia, anxiety, and persistent shaking, which took her away from her role of a surgeon for 6 months. And also I've had to wait for the blood test results as well. So, you know, the physical impact of the treatment, the psychological impact of waiting, and then also being you know, being unable to work as well, which has a big impact on people's mental health. We talked about doctors and nurses, but I think there's also really important that we don't forget our ancillary staff, our domestics, our porters, our sterile services, our laundry support workers, who also come across needles and sharps and have needle stick injuries. And you know, often we don't know the source patient of those needles, and you know, the consequences for them can be you know, can be very serious. So as I say, just to highlight some of the impacts on the individual. So, you know, I think those case studies, having to wait for test results, the fear of infecting family members, so having that conversation with your partner, and you know, precautions that you may need to take, anxiety, depression, post-traumatic stress, and you know, we have heard of cases where healthcare workers have been unable, you know, to actually handle sharps, you know, for some time after an injury. Side effects of treatment, which the case study of the doctor illustrated very well, and also the potential loss of earnings. So there's impacts there on the individual. And then impacts on the organisation. So a report by the NHS Resolution recently looked at claims on Sharps injuries, and they were in excess of 10 million, and that's over. Sorry, I think that was over a 10-year period. They were in excess of 10 million, and that doesn't look at things like the cost of treatment, the backfill for staff, sickness absence, needing to attend occupational health or specialist appointments. And then you've got the resources of health and safety teams to follow up and investigate. And that's just general perception of staff feeling unsafe in an environment where they're being put at risk. And then also we've got things like the cost of health and safety executive interventions. So if a health and safety executive comes in, does an inspection as a result of a riddle reported injury, or does a proactive inspection in the environment, and they see breaches or contraventions, then they will charge a fee for their time, and they will also potentially prosecute, which obviously ends up in costs for the organisation. So that's just a bit of a snapshot. I'm now going to hand over to my colleague Rose to talk about our guidance and also other factors to consider as well.
Thanks, Kim. There we are. Hoping you can all see that slide. So I'm going to recap a little bit again, because it's really important that people understand when and how Sharps injuries occur, as this is information that we need in order to prevent future injuries from occurring. A Sharps injury is defined by the Health and Safety Executive as an incident which causes a needle or a blade, such as a scalpel or another medical instrument, to penetrate the skin. But as Kim said, Sharps injuries can also occur as a result of other items breaching the skin, such as fragments of bone, patient's teeth, or in the laboratory setting, for example, test tubes and other items that can shatter. What this means is that there's a wide variety of healthcare professionals that can actually be injured as a result of a Sharp. Our Sharps survey back in 2020 identified amongst those 7,500 respondents when they had actually experienced Sharps injuries. Of the 63% of respondents that said they had experienced a Sharps injury in their career, actually 15% had experienced a Sharps injury in the preceding year up to our survey. So that's significant. Whilst 49% their injury was caused with a sterile needle, that means that the other 51% had actually been used on patients. So that's a significant number of nurses. Alongside other international literature, we know that injuries before the procedure, during disposal, or as a result of improper disposal continue to occur. Interestingly, although safer Sharps devices have been implemented, device activation and other moments when these devices are being used can also result in a Sharps injury. So I'm going to talk for a little bit now about some of the regulations and legislation that is there to support your employer, but also to support you be safe whilst you are at work. The Health and Safety at Work Act 1974 and the Health and Safety at Work Northern Ireland 1978 legislation places a general duty on employers to ensure the health, safety and welfare of all their employees whilst they are at work, so far as is reasonably practical. This is overarching legislation that you will all have heard of and be familiar with in some way or another. Expanding on the requirements of the acts or various orders, there are a number of regulations, again, which employers have to adhere to, and some of these are listed below. You'll see that COSH, the control of substances hazardous to health, is also included, and we'll talk a little bit about that in a bit more detail in a moment. So there are a number of regulations, and these are detailed in our Sharps guidance. So please do refer to that if you want some more in-depth information. But I just wanted to point out, because we're going to refer to this particular group of individuals shortly, that the safety representatives and safety committee regulations are also part of the overarching legislation and regulations supporting Sharps safety. So everyone has a role to play in terms of supporting safe Sharps practice and a reduction in Sharps injuries. There's the individuals that use Sharps, team members, managers and employers. And we do have responsibility to protect those that do not use Sharps, but as Kim said, are often injured as a result of indiscriminate disposal of Sharps, such as laundry staff, estate staff, and our domestic staff. So, how to think about implementing the available guidance and regulations. Implementing the guidance, there is lots of information out there to support both employers and you, and this is really focused on an organisational approach and risk assessment to identify where it is that Sharps are most frequently used, and using your local data when Sharps injuries actually occur. So there's a number of simple questions, and again, there's more information in our Sharps guidance that can be asked to support your organisational risk assessment and then consideration of what needs to be done to reduce the risk to staff. So we need to consider who may be harmed by Sharps and how, where specific precautions may be required because we're unable to remove the use of Sharps, and to assess how we're going to continually address the removal of Sharps or the implementation of safer Sharps devices once that decision's been made. So there's an ongoing issue around review, constant review, assessment, risk assessment, to make sure that the situation remains dynamic and that unidentified risks do not occur. Alongside this is the hierarchy of controls, which I'm sure many of you will have heard of, both in relation to RCN guidance on the use of gloves, but more recently around protecting staff from airborne infections such as COVID-19. And the hierarchy of controls are used widely and go through a logical order to eliminate risks and manage risks that remain. Now, Kim mentioned that in health and care, it's very difficult to actually remove many Sharps because we need to use them as part of our delivery of patient care. So the hierarchy of controls focuses on the most effective measures of removing the hazard first, rather than relying on training, behavioural changes or other work practices, and then the use of protective equipment. And this follows the principles of COSH that I mentioned a moment ago. So the hierarchy of controls provides a framework for reducing the risks of injury, but needs to be considered as part of a holistic assessment around the use of Sharps. One of the other factors that is driving how we manage Sharps, and also innovation both in Sharps but also Sharps disposal, is climate change. Once used, Sharps have to be disposed of, and traditionally we have used single-use heavy-duty plastic containers which are incinerated. We know that Sharps injuries can occur when Sharps boxes aren't put together properly, and also when Sharps may actually not be put correctly into the bin or are sticking out of the lid at the top. So there's been a lot of consideration given in order to manage sharp safety around the design of sharps boxes. The NHS has recently published a new clinical waste strategy, which has been developed to support the NHS and actually the United Kingdom meet the requirements of climate change legislation to reduce our carbon emissions as a healthcare service, but also as a country. And this legislation sits alongside our national waste guidance, known as HTM 0701, which now heavily focuses on sustainability as an opportunity to both reduce our carbon emissions, but also to make health and care safer overall. It may seem a little ironic because as healthcare professionals, we come to work to support people, make them better and give them the best quality of life that we can. But actually, through the delivery of health and care as the largest employer in the country, we are also one of the largest emitters of greenhouse gases such as carbon dioxide and nitrous oxide. If we were to look at health and care globally, as a country, we would be the 5th largest producer of greenhouse gases globally. So health and care services have a significant role to play in the reduction of greenhouse gas emissions and to try and mitigate the effects of our warming planet. And our new clinical waste strategy will help us do that. Historically, in relation to sharps, we have, as I said before, used single-use plastic heavy-duty boxes to manage used sharps, which we then incinerate. But we now have an opportunity through innovation to have reusable sharps boxes that reduce the need for plastic and then also help to recycle some of the metals that are used in sharps. So sustainable options now exist to support the use of sharps in healthcare settings, predominantly in hospital settings. Of course, sharps are used across the piece in the community as well. So it's important that whatever sharps containers are used are appropriate for that particular member of staff in that particular incidence. And there's increasing data now available to show that actually we are successfully reducing carbon emissions and sharps injuries as a result of innovation in sharps box design. I'm going to hand over to Kim.
Thanks, Rose. So we're just looking at how we can support the implementation of the guidance on sharps injuries at a local level. And as the RCN is a professional body and a trade union, we do have a number of accredited RCN safety representatives who can play a really important role. So these safety representatives are nurses, healthcare support workers who are practicing nurses, but also take on this additional role as an RCN safety rep to actually work with members, work with the employer to improve the environment and to raise concerns on behalf of the workforce. And we provide them with support and training to do that role. So just looking at their role, which is mandated under the Safety Reps and Safety Committee regulations. So they have a role that the employer has a duty to support them to carry out this role. Some of the things that they can get involved in is to talk to members to encourage better reporting of incidents and help support the organisation change that culture to a reporting culture and away from a blame culture. They can have access to policies, risk assessments, and really we'd want to see the employer working with them to ensure risk assessments are appropriate, they're up to date, they're regularly reviewed, and that policies are appropriate and being acted on and being monitored and reviewed as well. They have a right to access data on sharps injuries, and we would suggest that this is presented, if it's not already, at your safety committee or safety meetings, and that is a useful indicator of where hotspots are happening, what sort of issues are potentially, and what sort of instruments are leading to injuries. So I think that's really important that this data is presented at the safety committee, and our reps can work with the employers to scrutinise that data. And also they have a right to be consulted on the introduction of any new technology that can impact on the safety of employees. So we would again suggest that where organisations are introducing safety equipment to reduce sharps injuries, that they involve their safety reps and also the workers who are going to be using any new safety devices. And then working with the employer to making sure that training on safety devices and equipment is being carried out and is fit for purpose. And I think, just picking up on that training, the HSE did a study a few years back looking at the Health and Safety Executive, looking at the effectiveness of safer sharps devices, and they concluded that they are effective, but only when people are being trained on their safe use. So it's yes, having the devices, but also making sure people are trained on their safe use, and that would include agency nurses and potentially student nurses that aren't familiar with the equipment.
Hi guys, my name's Will, and so I've been selling safety devices into the NHS for the last 10 years. I'm going to talk to you about some of the processes that we typically use to affect change, and ultimately, hopefully, empower you guys to really understand how you can, be the difference, and you can, really affect these quite positive outcomes within the organisations you work with. And in some ways, you guys have got inherent advantage over to us sales guys in that we kind of have to be introduced to an organisation once the challenge has been identified. Where if you guys see a problem that you think is, isn't right, you can talk to people and they are going to listen to you. So I think there's a few kind of key points to consider when you're looking to affect change, and I think some of them you guys will do on a regular basis, and probably all of them. And it's really understanding what are the processes, practices, and products available to you to stop and reduce NSIs, and really understanding that importance of using them will stop preventable injuries and reduce unnecessary risks. Now, if a challenge has been identified or you believe there is a challenge, you need to kind of really question whether is it the process which is causing a risk, is it the practice itself, or actually are the products not right for what you're doing, and is there something better available? Now, one of the key bits that can really make a big difference, and I know it's been mentioned, is the importance of reporting. Unfortunately, we live in a time where if there is no data, it's almost like no problem truly exists. And so, getting that reporting culture increased is really, really important. But, if there is still a lack of that key data, evidence can always be found by auditing and actually by speaking to your colleagues within the organisations. I think the other thing to kind of be really aware of is that, the facilities you guys work within do have a responsibility to provide hospital staff with safety engineered devices and the best equipment available. So I think it's key to remember, if you identify a practice that could be made better and you've got some data to back it up, you've got a really, really strong case to go and speak to your procurement team to drive that change. Now, it doesn't necessarily have to be the procurement team you need to speak to straight away. Your health and safety colleagues are normally, well, not only normally, they are fantastic. And you've also got your RCN safety reps, IPC, and loads of others that can help you get this information. Now, I think the key things to remember are there are kind of 5 key steps that really make a difference. And by utilising this kind of flow, you really will be able to make quite a difference to your organisation. So I'm going to talk a little bit now just about the experience of why we maybe start this process from where I'm currently at. So data and evidence is key. So we're invited into a large teaching hospital because they had a challenge with needle stick injuries due to sharps protruding from the tops of sharps bins in their ED department. Now, that challenge was first identified by a senior clinical nursing lead. She then went and spoke with their health and safety team. And at that point there, they were like, okay, actually, there is a bit of a challenge. In the last 12 months, they had 9 reported sharps injuries in relation to disposal activity. And at that point there, they did a little bit of research and actually identified there was a product that could eliminate overfilling Sharps containers. And again, I feel the compliance issues like temporary closures, could be affected. Now, they also didn't just say it's the product that's a problem, and this is a really key thing. They looked at the process itself, and the fact that there were maybe some key things that weren't being followed, that could have again created undue risk. At that point, there, we were invited into the hospital. We walked around the ED department, carried out a bit of an audit where we looked at, was the challenge from the process, the product, or maybe it was actually a combination of them both. And after this walk and consulting with that team, we actually kind of identified that there was a better solution for them. It could completely eliminate overfilling and some of the compliance challenges they have with temporary closure. And what was lucky in this point, we had data in that we had, yes, there were 9 injuries in relation to this over the period of 12 months, but also the kind of senior clinical leads that were carrying out regular kind of assessments also noticed a challenge. So at that point there, we generated a joint report, which talked about the potential product they would like the trust to look at, as well as the effects and changes to the processes that could be made by bringing this device in. At that point there, the report went to IPC, clinical procurement, and a few key clinical leads. And we got some interest. And the action that was proposed was to trial this product and system within the ED department, as well as the proposed change and amendments to some of their kind of key policy around handling of sharp spins. And the expected outcomes would be a complete reduction of these Sharps injuries. And actually, over that 2-month trial period, the outcomes were achieved. But more than that, now it's been in over 12 months. Those previous 9 injuries that had occurred had been completely eliminated, and no injuries were kind of seen over the 12 months following. Now, I think the key things, if you want to drive that change, if you can find any data, it's huge. But also, if there is no data to back it up, because we know there's a challenge with reporting, anecdotal, if you see a challenge, go and engage with your RCN safety reps, health and safety, IPC, clinical leads, or the clinical procurement teams, because they will listen and they are there to help you out. Once you've done that, is there a better product? Is there a better process that can be put into place? Take it to a larger group of individuals that can affect that change for you. Come up with a plan, propose the changes, and make sure any outcomes that you would like to trial are measured. Again, that data is key from the beginning, but also to prove the benefits of such a system.
We're coming towards the end of the webinar now, so we're going to bring it all together. And what we would really like to do is have some discussion and some debate with you around how we can support you to have safer Sharps practice where you work. And I can see in the chat that there's been some really good points made there, so we can pick up on those shortly. So to bring the webinar to a conclusion, there's 3 points here that we'd like you to think about before we have the discussion. So what does Sharp safety really mean to you in your role? Because it will be slightly individual and slightly different for all of you, depending on your role and the setting in which you work. So it's very much individual, going back to the need to do risk assessments through your organisation. What actions or what knowledge that you've gained today are you going to take away, reflect on, and potentially take further in your workplace to support not just your safety, but the safety of your colleagues? And then what more might we need to do to support you as a Royal College, but also Sharpsmart as innovators and manufacturers of Sharps containers as well, to continue to keep this risk of Sharps injuries low? We thought we'd end the webinar on thinking about what good looks like, considering all the information that we've presented to you today, but also the concerns that we have around the ongoing risks of Sharps injuries, and in particular with the 2020 survey, what looked like an increase in incidents of Sharps injuries that we need to understand a little bit more about so we know whether or not this represents a change in the trends of Sharps injuries, or whether this was just a one-off due to the pandemic. So what might good look like? There's a few thoughts from us here on this slide. And we thought we would start with actually a clear vision of what it is we want to achieve. The gold standard, of course, would be that no healthcare professional is harmed as a result of a Sharps injury, and that no Sharps injuries ideally occur. That being very challenging, what we would like to see, of course, is an increase in data and reporting of Sharps injuries, so we can actually use that data for action to improve your health and safety in the workplace, and support your employers to improve safety where Sharps injuries occur. We would like to see data shared in a meaningful way, and that learning occurs as a result of that. Like personal protective equipment, safe Sharps devices should be provided and available at the point of use, so they are there whenever anybody needs one. And finally, in recognising our other colleagues working in health and care that don't necessarily use Sharps, but who are often harmed as a result of them, we would like to see that no domestic porter, ground staff, laundry staff, etc., are harmed by a Sharp originating from use elsewhere. Thank you very much. I'm going to hand over to Gemma now, who's going to lead a short discussion.
Brilliant. Thank you, Rose. So thank you, Kim, Rose and Will, for the great presentation, really insightful. So we now have time to run through some of the questions, some of the comments that have come through the chat. So let's kick off first with a question that came in near the beginning when we was going through the Sharp survey results from Josh, which I'll follow up with a poll as well. So if you could all please take part, that'd be fantastic. The question is, why do you think people aren't reporting Sharps injuries?
Shall I kick off, Gemma?
Yeah. So,
I mean, I think there's a couple of issues for me. I think people often don't report injuries with clean Sharps, although the regulations do stipulate it don't actually make a difference between clean and used Sharps. So obviously there's lack of reporting of clean Sharp injuries because people don't perceive that as a risk. But I think that the pushback to that is actually it's the procedure that's being carried out, it's the environment that procedure is being carried out in, all those factors. You know, next time the injury happens, it could be a used dirty needle. So I think we do still need to encourage reporting of clean needle injuries, but I think that's potentially why people don't report. And then also looking back at the video of the senior staff nurse from St George's, I think there still is that sort of that culture of like, it was my fault, I'm to blame, I didn't practice safely. So again, people might, hopefully it's a minority, but they might sort of be very worried about reporting because of that sort of culture. But again, I don't know if Rose has anything to add to that.
Thanks, Kim. So time is a really big issue for staff. It's always busy in health and care, but it's particularly challenging at the moment. And actually, I can see a number of people have popped in the chat that that time is a significant barrier in terms of reporting. When I talk to staff also, one of the, not quite sure how to describe it, they get very disappointed because they rarely hear anything back. So even if they report, there's no feedback in terms of what happened as a result of that incident or that injury necessarily being reported, particularly if it's a clean injury, of course. And then staff not hearing about the organisational data, so they develop an awareness not just of what's happening in their area or their directorate, but actually across the organisation. Often if you can see the bigger picture, it helps to put what's going on where you work into perspective, but also to go and talk to those other staff that may be experiencing similar challenges to you, to come up with some solutions that support you both. So we really need that data, but we need organisations to be more transparent about the data and to actually disseminate it in a more timely and obvious way.
Brilliant. Thank you both there. I can see a lot of people commenting in the chat. So yeah, thanks for a good conversation. Another great question that's come through from Jules, actually, again, an open question to you all, is how do you change a culture of we have always done it this way with regards to change to really help drive effect?
Shall I go first? Oh, go on, Will, you go first.
No, I was going to say, from my standpoint, I think the big thing is it's hearts and minds, because, you know, whenever anything is seen as change, there's always going to be a large opposition to it. And so it's not always, you know, by telling people that this particular thing is going to make it safer for you, if they don't necessarily see or perceive the benefits, it's really hard to actually think, oh yeah, this is it. So if you can have any other supporting reasons and rationales, and the big one is, you know, that ease of use. Can it save nursing time? Sustainability is usually on the agenda. Can it make the organisation a bit greener? And, you know, as long as you can kind of hit a few key points, generally speaking, you know, I think that change can be affected, but it's all about getting the message to that individual correct, because just because for you it might mean one thing, for that group or those group of colleagues it might mean a completely different thing. So it's just trying to understand, you know, what's the benefit to them, because yeah, the benefit to you might be completely different.
If I can add a couple of things there, and I think looking at organisations, and there are some organisations that have converted completely 100% to safety devices from NHS supply data, and I think that some of the key things that they had was clinical leadership, so you know, that message from the top, but also engaging and involving the end users in selection of products as well, so they feel you know, part of that change journey. So, and again, you know, there may be some more suggestions from colleagues on the call, what they've done themselves. So yeah, just to throw that in.
If I can come in, I've just noticed in the chat that some people have been actually very honest about potentially being embarrassed to report that they've had a needle stick injury, and I would just like to take this opportunity really to reassure you, and you know, to say that there is nothing to be embarrassed about. Sharps injuries occur for a variety of reasons, whether that's because you've become distracted, whether it's because the equipment you're handling is actually hard to handle, whether it's because you're tired, the lighting's not very good. There are a variety of reasons that Sharps injuries occur. So please don't ever be embarrassed about reporting one.
Thank you, Rose. That's very true. Continuing then with Sharps injuries, what are the top things an organisation and an individual can do to prevent these injuries?
Okay, so I mean, I think a lot of it's been said already, really. I mean, I think, you know, report. Obviously, conscious of what we talked about time, about being embarrassed, but you know, if without reporting, without that information and data, the organisation, as well as said, will just say, you know, there's no problem, there's not an issue here. So that on the individual, I mean, again, you know, time and staffing levels comes into this as well, in terms of things like, you know, don't walk past an unsafe situation. So if you see needles sticking out for Sharps bin, you know, take that responsibility to do something. But again, we've got to be conscious of the context that people are working in, you know, and the staffing shortages, but just don't walk past an unsafe situation or an unsafe Sharps bin. And you know, if you know who your safety rep is, you know, there might be RCN reps, there might be Unison safety reps, Unite GMB all have safety reps. If you're concerned about the environment and you're concerned about safety, then you can use your reps to raise concerns at health and safety committee meetings or with the employer on your behalf. So so yeah, so those are top three from individual. yeah, for an organisation, well, I don't think it's a tip, but basically make sure you follow the regulations, because I think the Health and Safety Executive are currently inspecting a handful of trusts and boards across the UK at the moment, or have just finished their inspections. So they will be coming down on organisations that haven't been following the regulations. And I think importantly to review and monitor those policies and risk assessments. They're not just documents that, you know, sit on the shelf. They should be active living documents that are reviewed and monitored following injuries, following accidents, following data on hotspots. So yeah, again, on top of what Will's already said, and again, work with your union safety reps as well to come up with solutions to problematic issues. So Rose, if you.
Yeah, thanks, Kim. I'd just like to, excuse me, add a couple of potentials where innovation might actually help to reduce Sharps injuries. And you may have some thoughts on the first one. So the first question I would pose is, what would make reporting easier for you? If you're reporting lengthy paper forms, then what would good look like? What would make it easier for you to report Sharps injuries in a way that gives us data but doesn't actually take up too much time for you? That's something that you can think about, perhaps pop in the chat. You know, we're moving into a far more digital world now. So are there some digital solutions perhaps that might help? And I've just noticed in the chat a note about glass ampules, and certainly I remember injuries as a result of taking some very difficult tops off of glass ampules. So maybe there's some innovation there that we can pass back to manufacturers around potentially different designs of drug delivery that are used in clinical practice. And lastly, from an individual perspective, I'd also like to pick up on a point in the chat about taking a Sharps bin with you when you use Sharp. So this should be what we would call best practice, in that you take a Sharps box with you if there isn't one that's provided where you're going to use it right next to the patient, because that will actually mean that disposal takes place immediately after use. So there should be no danger then to others, but also to you as a result of using that Sharp. And a variety of different size Sharps boxes should be available to make that easy for you, whether you work in the community, mental health, or an acute care setting.
Thanks again, guys. Appreciate your honest answers there. We've had a few more come in regarding where certain bits of data are, and we'll follow up with all of you individually on some of them. We've got a few minutes left, and there's sort of one question that I feel in conversations I've had has been quite prevalent with the NHS, in particular focusing on sustainability and their green plans and route to net zero. With the NHS moving towards a sustainable future and reusability, is this going to compromise both staff and patient safety?
Do you want me to come in there very quickly?
Yeah.
So sustainability is going to become an increasingly significant issue in terms of how we deliver health and care, but also in terms of what we use to deliver care. And it's going to run through every single part of the life of health and care organisations. In the conversations that I have and in the groups that I'm part of, patient safety absolutely remains at the centre of everything that we are talking about and also considering when it comes to sustainability. Some changes are going to be relatively simple because they're underway already. So, for example, the move away from paper to more digital solutions and things like that. But other changes are quite significant. So we have to keep the patient at the centre of this, but it does inevitably mean working slightly differently, delivering care in a different way, and that means adjustment and change, which always come with risks. So keeping any change under constant review and actually reporting if risks are there, both potential risks and actual risks when they take place, will really help us understand what it means to be a more sustainable health and care industry.
I think the only other bit to kind of mention, there is also inherent benefits to a reusable device, kind of coming from both sides of it. In that a single-use device, generally speaking, the cost of manufacture is low, whereas something reusable might have to be used, 500 times or more. And so it gets the benefit of, instead of something costing a couple of pounds to make, it might cost £100 or more. And so it allows the manufacturers to put in additional kind of features, benefits in terms of safety and use. So, not in all cases, but more often than not, something that is reusable is going to be inherently safer because of the cost of the manufacturer. It allows, so much more to go into it. And yeah, I think, it really will start making a difference. Obviously, size, there are, as Rose said, changes or slight changes to practice when it goes to reusable. But I think, the inherent benefits that come with additional features are huge.
Brilliant. Thanks, guys. So we're just about out of time. We've got 2 minutes left just to wrap up. Again, there's some more questions in the chat, so apologies if we haven't got around to answering them all. Please feel free to reach out to the team directly. Their emails are on the screen, and we will keep a copy of the chat and try and get back to you with some answers. So thanks again, everyone, for joining us. I do hope you found this presentation useful. Sorry about the technical difficulties with the video, and I know a few people were unable to join. So a recording will be sent round within the next week. So please keep your eyes peeled. And you'll shortly receive an email from Sharpsmart with some additional resources from the RCN and Sharpsmart to help you in your drive to making healthcare safer. So thank you, Kim, Rose and Will. Thanks again for listening, and I hope you will have a lovely rest of your day, and we hope to see you again soon.